Israel continues to struggle to contain the Delta variant. Cases are surging, and from a country that was green only a few weeks ago, Israel has deteriorated back to the numbers of the third wave of the pandemic. Even the United States Center for Disease Control and Prevention, or CDC, has changed Israel's classification to level 4, the highest level, recommending that Americans avoid traveling to the country. So, how did we get here? Are we on the verge of a fourth lockdown? And how is this government handling the crisis compared to the previous one? Here to answer all these questions and more is Professor Manfred Green, Director of the University of Haifa's International Master's Program in Public Health. Welcome. So, first of all, how did we get to this point?
Hi, how are you?
I'm good, thanks, given the circumstances, but I need to ask, how did we get to this point?
Well, you know, the virus is with us, and it's been with us, and it will be with us. So it's not just going to disappear. And as long as people who are infected come into contact with people who are either not vaccinated or not immune from the disease, it'll spread. And the Delta virus spreads very easily. So the only real impact that we'll see is if we prevent the spread by using masks, which is the most important thing, and making sure that this use of masks is enforced, because I think what I see is that it's not really really enforced. And I think we need to improve, obviously, the vaccination rates. We still have a large number of the population who are still not vaccinated.
And yet, I mean, Israel is a world leader in vaccine rollouts. And despite this, though, I mean, it seems we're on the verge of lockdown number 4.
Yeah, I think it's related very much, though, to the behavior of the population, and I think we need to make the message much clearer. At least when I go out into the supermarkets or into closed areas, I don't see that there's very much enforcement of using masks, for example, which is a simple protective measure. I think that should be done. I think it should be done in schools. I think it should be done where any large gatherings take place. And I think we should try and limit large gatherings, because these are places that they're going to be spread, unless, of course, we can introduce very rapid testing of everyone who goes into the gathering.
Now, I mean, you say this, but on the other hand, Ayelet Shaked, Prime Minister Bennett's number 2, said yesterday that, well, this is a pandemic, and in a pandemic, people die, saying that the government has adopted a live alongside the coronavirus strategy, and basically accepting that people are going to die. I mean, is this really the government's strategy? Are they looking perhaps to get herd immunity?
I don't think the strategy is to let people die. We certainly wouldn't want that to be a strategy. I think the strategy should be to minimize damage and to minimize death. And that, the way in which you do that is to minimize infections and make sure that the health services are adequately prepared to actually treat patients. So the more patients there are in hospital, the more difficult it is to treat them. So we need this increase in staff. The hospitals are generally very understaffed. There are not enough beds. The infrastructure is poor. We should be building more hospitals. Even now, we should be talking about building new hospitals. So that's another issue. But in general, we really need to make sure that people are protecting themselves and others, and in particular, using masks. Masks is a very good protective measure.
Absolutely. Now, Prime Minister Naftali Bennett, while he was in the opposition, wrote a book on how to combat the coronavirus without lockdowns. And it seems that now we might as well, throw that book out the window. I mean, in fact, most of the ministers in this government were very critical of the previous government's handling of the pandemic. So I'm curious, how are they faring now in comparison? I mean, critics saying the government has imposed restrictions too little, too late to curb the surge in cases. I mean, do you agree?
A lockdown is a temporary procedure. So in any event, you can have a lockdown. It will temporarily halt or reduce the spread. Once you open the lockdown, it starts again. We need to really enforce the other measures. Much better ventilation and much less crowding in schools. Much better public awareness that they basically have to wear masks. The other thing, by the way, is the actual identification of people who actually are positive. That still seems to be a weak link, where people are actually tested and either they don't know the result or the result doesn't get to the authorities. At least there's no connection. I hear of more and more cases of people who are tested positive and no one has contacted them. So they're not even sure that they have to be isolated or not. So this requires a much greater increase in staff who will actually be monitoring the cases and testing people to get the infected people out of circulation.
Absolutely. These are all crucial measures, and we hope that they will help in preventing the pandemic. Professor Manfred Green, thank you so much for taking the time to speak with us today.
Thank you very much.